Hello, everyone. I'm Dr. Rohit Srinivas, consultant intervention radiologist at Gleneagles Hospitals, which is a Fortis Network hospital at Richmond Road, Bengaluru. Today, let's discuss about the role of interventional radiology in kidney cancer. So, before we get into the details, I think two main things that all of us need to know when it comes to this topic is what exactly is interventional radiology, and when I say kidney cancer, what is kidney cancer? When it comes to intervention radiology is a super specialized branch of radiology which uses radiology equipments like CT, ultrasound, fluoroscopy to treat various conditions or diseases minimally invasively. And when I say minimally invasive, I mean that there are no cuts, no stitches, and no open surgeries. So we do procedures through a tiny pinhole and get the maximum or results in a very effective and a safe way. With IR, we do procedures which are minimally invasive. These are usually needle or catheter based treatments. Okay, so now we've understood what IR is. Now let's discuss what kidney cancer is. Kidney cancer, in medical terms, one of the most common types is called as renal cell carcinoma. These patients usually present to us with pain in the loin as in one of the flank regions, predominantly. The other thing they can present to is blood and urine. Sometimes these lesions could be completely asymptomatic, as in the patient is not aware at all that he has kidney cancer. And that is where regular annual health checks become very, very important. So, during a lot of times, these cancers are picked up incidentally when the patient goes for a health check for his work related stuff or their annual health check. A lot of times you're doing CT for some other cause, and then you pick up a tumor in the kidney. So that is in brief about what kidney cancers are about. So where does interventional radiology fit in when it comes to the kidney cancer and the spectrum that I'm discussing? So previously, when I say cancer, the word is the kind of dreaded, right? Like a lot of times people thought that if somebody has cancer, that is end of life, there's no more hope to life. With the advancements in technology as well as medical field, that is changed to quite a bit. So right now we have cures. When I say for a lot of conditions, they are potentially treatable, and that is where uh, interventional radiology also plays a major role in kidney cancers. So, interventional radiology as such plays as a significant role in early stage kidney cancers. When I say early stage, the tumors which are in size less than about 3 to 4 centimeters, and then there are certain patients who are not actually fit for surgery, meaning one, because of their age, because of their other comorbidities like diabetes, hypertension, or heart related conditions, and other stuff, they might not be fit for a major surgery for the renal tumor. The other condition is where the patient has a single kidney and there is a tumor, and you want to kind of retain as much as normal kidney possible. So, these are the conditions where interventional radiology plays a significant role in treating renal tumors. Another condition which I kind of missed was in tumors which are bleeding actively. So, when the tumor starts to grow in size, there is a possibility that the tumor can start to bleed within, so which eventually is a life threatening condition. And interventional radiology, through a very simple and a very effective procedure, can actually stop the bleeding per se, so get the patient out of that acute phase and acute condition which is life threatening. And then it kind of bridges to further treatments, whether it is intervention radiology or open surgery, whatever the patient necessitates, so at that point of time. So today, I think I've given a brief overview of what exactly IR is, what exactly renal tumors is, how do kidney cancer or renal tumors present to us as doctors, and where does interventional radiology fit in. So, uh, further on from now on in this Facebook Live, let us discuss what are the most commonly asked questions to us as doctors when the patients come to us. So, the first question they ask us is, Sir, what are the things that we can offer in interventional radiology to people with kidney cancer? So, when it comes to the treatment, if I have to kind of divide it into two broad specialities, we have something known as the ablation, and we have something known as embolization. So these are the two broad categories where intervention radiology, or the type of treatment in intervention radiology that we offer to uh, to kidney cancer. So, when I say ablation, if I have to kind of break it down and put it into simpler words, it's like we place a tiny needle into the area with the help of image guidance so that we're very accurate on where we are placing. And then we try to destroy the tumor cells from within. And if you ask me how we do it, there are different modalities or the treatment options. So we have something known as radiofrequency ablation, microwave ablation, and cryoablation. So these are the three widely used and the most frequent ones which have been tried out for kidney cancer worldwide. So in radio frequency as well as microwave ablation, we gently heat up the tissues from inside. So when we cross a certain temperature, the tissue or the cells there kind of die after, like it's simple, like you're boiling milk post a certain temperatures, you expect all the organisms to die, right? So a similar concept, you placed a small needle, you're accurate of where you've placed, and then you gently burn the area from within so that you're able to destroy the kidney cancer. For liver cancers, we've been doing it for quite some time and it has been the standard of care. Renal cancers also, they say for lesions which are less than 3 to 4 centimeter, it is a very, the results are as similar and effective to surgery, or even slightly better. And for patients who are not fit for surgery, or patients who have a single kidney, this is kind of a boon. The second thing which has been doing a lot of waves in the medical fraternity, or probably we say when it comes to ablation, is the standard of care right now, is something known as cryoablation. Now, cryoablation does exactly the opposite of what we're doing in RF or microwave. So, again, the principle is the same. You place the needle under image guidance, and in cryo, as the name suggests, you're trying to cool the tissue or freeze the tissue. So, when the temperature drops by a certain degree, the cells kind of get frozen and they die. So, we try to achieve targets in minus temperatures, probably minus 40, minus 80 degrees. So, the cells freeze, so all the cells within the tumor kind of freeze, and the tissues die. And over a period of time, the body absorbs it, and it becomes like a small scar. The advantage is, again, with cryo, is we exactly know to how much we're able to kill the cells, so that we are trying to preserve the kidney, which is normal, which is not affected by the tumor. So we can be very accurate when we are treating with kidney cancers. So if you ask about what the major advantages of ablation is, one, a small tiny needle is inserted through the skin. A lot of times, this needle can be inserted either in local anesthesia or just some sedation, and then we use, as I said, heat technology or cold technology to slowly destroy the tissues from within, which again, uh, IV sedation, like a lot of times you do not require general anesthesia. Only in certain individuals we might prefer general anesthesia. And the biggest advantage is there are no stitches, no cuts. So you're getting the results of surgery without undergoing a major surgery. And because there are no stitches or cuts, the recovery is much faster. Patients can get back to their routine activities much earlier. The other major advantage is the normal kidney, which we're trying to preserve, is preserved as much as possible. And in case later on, if there is another tumor which kind of grows somewhere else, there is always a chance to repeat the procedure again. So this is all about ablations in kidney cancer. So the other condition or the other treatment option that we IRs provide is known as renal artery embolization. So if I have to kind of put it in simpler words, angiograms to the heart, a lot of us are aware of it. So it's kind of a parallel to this. So we do a similar thing. We do the angiogram of the kidney tumor. So we go in super selectively to the blood supply, which is supplying the tumor or the kidney, and then we try to block or cut the blood supply to the kidney tumor. When when we do that, what happens is the tumor is devoid of its nutrition. So, and then it slowly starts to shrink in size. The the two main indications where we kind of do renal artery embolization is one, in an acute life saving and an emergency situation where there is an ongoing bleed within the tumor that is happening, and this works like magic and wonder. You go in, stop the bleeding there, and the patient's life is saved. The second time is when the tumor is too big, and doing the surgery upfront can cause a lot of blood loss. So going in, we call it pre-operative embolization, wherein you go in and do the embolization 24 hours to 48 hours before the surgery. So you're trying to reduce or minimize the blood loss that happens during surgery. The third area where IRs make a difference in renal tumors is biopsies. Biopsies, as all of you are aware of, is wherein you put a small needle and then take a tissue sample from there and prove it for analysis. So kidney tumors routinely, we do not really do biopsies, but in certain scenarios and certain conditions where the diagnosis is equivocal, wherein we are not really sure whether it is a cancer or a condition which is not cancerous, to prove certain times a kidney biopsy would be required, and IRs do it to perfection because they're well versed with the imaging technology as well as their needle skills. So, if I have to kind of summarize, who is an ideal patient for IR? Patients who have small tumors in the kidney, which means we pick them up at an early stage, so they can be treated without actually undergoing the surgery with a minimally invasive approach. Patients who have single kidneys, wherein one kidney has been removed, or a patient has a single kidney from life, so you want to preserve as much of the kidney as possible to prevent further in when to for the patient to go into chronic renal disease. So that is one of the condition. Elderly patients, patients who are 70 plus, 80 plus, wherein actually the surgery itself is major risk when it comes to morbidity as well as mortality, wherein the overall quality can get affected. So that is again a condition where we can consider renal IR in renal tumors. The second thing is a lot of comorbidities. Patient has a heart condition, patient has liver, and other conditions. So again, it becomes a very high risk to do such a major surgery. IR gives you a great alternative. So one thing that we all need to know is IR in kidney cancer is an organ preserving approach. We try to save as much as normal kidney as possible, and then I think through this Facebook Live, I would like to say that not everybody requires a kidney removal. It depends upon the size of the lesion, what is the nature of the tumor, and then depending on that, we can kind of cater to different patients and different scenarios. Now, I think another question that we I kind of keep getting asked is IR versus surgery. So, is intervention radiology can treat all of the kidney? Can it treat? Is it probably surgery is not required? So, that question, I think the answer to that is no. They're two different entities. IR plays a very crucial and an effective role in certain areas, and the results are almost similar or slightly better than surgery. So we'll have to treat it as two different entities, and depending on the patient, we have to tailor it to that particular patient and that particular condition. So IR may not be suitable for all kidney tumors, and the same with surgery as well. Might not be this. It might not be like a blanket saying that we can do surgery for everything. So every treatment and every modality has its role. All of it again depends on what is the age of the patient, what is the comorbidities that he or she is having, what is the size of the tumor, where exactly the tumor is located, and all of it for us to come to an answer. But if I have to reiterate, when it comes to intervention radiology is minimally invasive. It preserves the kidney to the maximum. There is faster recovery. There is no cuts, no sutures. So it works amazingly well when we choose it for the right patient. So I think the closing message is one: do not be scared if you've been diagnosed with a kidney cancer. So think early. If you are in the early stages of kidney cancer, I think interventional radiology is a great alternative and offers a very safe, effective, and kidney saving options or treatments for renal cancers. So I'll just check if there are any questions or comments that I've had. Okay, so I have a question on my the chat which says, if there are two tumors in a single kidney, can we still do IR treatment? Yes, I think that is a great indication. So if you have two tumors, imagine one in the upper part of the kidney and the lower part of the kidney. So if you have to do a conventional surgery for the same, either they'll have to remove the entire kidney, or probably do there is a significant chunk of the normal kidney also that kind of gets removed when they're removing both the upper and the lower pole. Whereas in intervention radiology and ablation, if the patient is actually a candidate for that, uh, we can treat both of them in the same sitting, as well as try to preserve as much as normal kidney as possible. So yes, I think that is it. Yeah, so those are the questions that I've had. And yeah, feel free to reach out to us with whatever questions that you have, and we'll try to see how intervention radiology can help in clearing doubts or even treating tumors with associated with the kidney. All right, thank you so much.